Hey, Bridget. Bridget, can you hear me?
I can.
Where's Stephanie?
Let me find out.
Victoria, can you hear me?
Yes, I can.
I cannot hear you.
You can't hear me? Can you hear me yet?
Cannot hear you.
Does anybody else hear me?
I do. I can hear you.
Wait,
Yeah, I
Aki,
can
I
hear
cannot
you.
hear you either.
Oh my.
Wait a minute, who can't hear me? Wait a minute.
I
can hear you in normal.
Okay, how's that? Can you hear me?
Yes.
My goodness. Denise, can you hear me?
Maybe this is my issue. I can't hear anybody.
Oh.
Turn your speaker up.
I'm going to log out and log back in.
Okay, you can't hear. Oh, she can't hear me. I wonder if she can hear anybody.
No, she couldn't hear me either.
Where's Stephanie? Where's Stephanie?
Thank you. Jeff Aludo, clerk to the board, Jackie Pianiotto, and there are many others on, and we will introduce them as their items come forward. So we are going to then move to a silent prayer and the Pledge of Allegiance. So I know this is a somber day for people, a day of celebration, but also a somber day with the passing of John Lewis. As you know, we have flags flying at half-staff today in honor of John Lewis per the resolution that we all passed on Tuesday. And so with your deference, we will dedicate the silent prayer today to the memory of John Lewis. So we're going to take a minute. Amen.
Yeah.
And Bridget, I assume you have the photo of the flag?
Thank you, Commissioner. 1 minute.
Okay.
Doesn't seem to want to come up.
All right. Well, I can look out the window. So we're gonna we will. How about we wing it? Oh, there it is. All right. Very good. I pledge allegiance
To
To the flag
of the
of the
United
United
States
States
of America.
and to the republic
for which it stands, one
one
nation,
nation,
under
under God,
God, indivisible,
indivisible,
with
with
liberty
liberty and justice for all.
Thank you. We will move to by leaves in just 1 second because I know you want to say something about the passing of John Lewis, and I'm speaking to both of my colleagues. But first, I'll move that we approve of the minutes of the previous session.
Second.
Commissioner Dreehouse,
Yes?
Commissioner Summer Dumas,
Yes.
Commissioner Parks.
Yes.
Thank you. Also on the agenda, we've got a presentation, a proclamation celebrating the 30th anniversary of American with Disabilities Act. And I do not know who's going to lead the conversation related to this item.
I'd like to lead the conversation if I may, Madam President. The American with Disabilities Act is a 30-year anniversary this year, 2020. Actually, July the 26th was the culmination of the 30-year. And since we met today, I wanted to have a couple people on the line to sort of talk about their involvement in the American with Disabilities Act. I don't know if Alice Pavey is on the line. Okay, I don't see her. But I want to recognize Alice because Alice is the superintendent and CEO of the Hamilton County Developmental Disability Services. And she's just awesome. I've met her since my time becoming commissioner. And she actually invited me to an event last year. And we tried to fool Commissioner Pertune and also Robert Harris because Commissioner Pertune thought he was coming to honor Robert, and Robert thought he was coming to honor Pertune, but they were both being honored. So I just wanted to thank her for her work in the field of disabilities. In addition, I did invite Robert Harris to be here today. And I don't see him on the line either. He is a disabled person who has been fighting for disabilities for over 65 years, so longer than I've been alive and most of you. He was also inducted in the Ohio Civil Rights Hall of Fame for his advocacy for disabled people for many, many years. So I wanted to take the opportunity just to acknowledge him and to make sure that he gets a copy of this proclamation. So I won't go through the proclamation. It basically talks about all the federal departments that are responsible for enforcing that disabilities are not discriminated against, and also any investigations that need to happen. So on this day, we recognize American Disabilities Act in the county of Hamilton County. And it's signed by all our commissioners.
Great. Thank you. Thank you for bringing that to our attention. It is, as you say, a very important move forward for people with disabilities throughout the country and the accommodations that allow them to fully participate in every way. So thanks for bringing that up. All right. Jackie, do we have any public comments today?
I have received some written communications via email.
Okay.
I sent copies to each of you, but we have one from Herschel Daniels, and it's quite lengthy, and it has to do with the usual topic, I believe, is the Bill of Rights and Slavery and Involuntary Servitude, and Monique Mason-Halter for the 5G installation and the hazards of that. And we have a communication from Angela Lowers, and that has to do with support of the new, it's the tall warden.
Dog warden.
Yeah, sorry.
Okay, so all three of us received those comments. So Jackie, can we please enter those for the record?
Yes, ma'am.
Okay, thank you. All right, very good. Let's move on then to comments of the commissioners. We do have a number of people on the line related to a buy leave that Jeff is going to introduce related to testing for Hamilton County. But I thought maybe we could get through the commissioners' comments first, and then we'll move to that item, Jeff, as your first item as you report out. So with that, we'll go to Commissioner Summer Dumas.
Thank you, Madam President. John Lewis's funeral is going on as we speak. It's just an awesome occasion and celebration of his life. And I just wanted to say, John Lewis, of course, to me is a Renaissance man whose impact has and will last throughout the ages. And I honor him by pledging, as he would say, to get into good trouble, which means to impact the people of not only Hamilton County, but also of the world and of the United States. And good trouble only means to work hard to right the wrongs that exist in our society. So I pledge to do that. In addition, Madam President and Commissioner Parks, I wanted to speak about the gun range, Lincoln Heights gun range. And for over 73 years, this gun range has impacted the village of Lincoln Heights. And just about, I was researching it, and just about every 10 years, this issue comes up. And I believe we're at the pinnacle of never talking about this again. I think that this commission, along with the mayors from Lincoln Heights, Woodlawn, and Evendale, the Cincinnati Police Department, they're also looking at alternatives along with the city of Cincinnati. And I think if we fervently work on this issue and look at the options that are available, that we will not have to talk about this again for forever. That I'm not saying we'll resolve everything by the end of this year, but it'll be a step toward resolving this issue. There will be a resolution coming up in the second week of August that will talk about a resolution to hopefully get support from all the commissioners that we agree that this gun range should be moved, should be closed. Now, where they move it, that will be up to the people that are responsible for doing that, but that we ask for it to be closed. And I keep hearing about the cost of doing that. And I think we need to take that variable out of the discussion, because there's no cost that can equal the damage that has been done to the people in Lincoln Heights for over 73 years. So I'm really confident about my colleagues that we will get this done, and the other people involved. I know Councilman Smitherman is waiting for an estimate to come in August about what the cost might be. But I also am discharging my chief of staff, Bishop Hilton, to formulate a small focus group to look at where we are, the impact on the people there, not only the physical impact, the health impact, the trauma, all those kinds of things, which will validate the necessity to move this thing quickly. So we'll be discussing that a little further as we look toward it. But first and foremost, we would like to get the support of all the commissioners, which have already indicated that you all are in agreement with that being closed. So that will end my report, Madam President.
Thank you. Commissioner Parks?
Yes, thank you, Madam President. Commissioner Summer Dumas,
Mhm.
I am in total agreement with you. When I go to Lincoln Heights, it traumatizes me.
Mhm.
I cannot imagine what the residents will live with and the harm that is done to the children.
Mhm.
My second thing is I praise God for John R. Lewis's life. While watching his funeral this morning, I heard that John R. Lewis loved America and spent his life on earth striving for the beloved community until America learned to love him.
Mhm.
Did indeed. I will honor him by reciting one of his favorite poems. That is one of mine. It is Invictus by William Ernest Henley. It was written in the 1800s. Out of the night that covers me, black is the pit from pole to pole. I think whatever gods may be for my unconquerable soul. In the fell clutch of circumstance, I have not winced nor cried aloud. Under the bludgeonings of chance, my head is bloody but unbowed. Beyond this place of wrath and tears looms but the horror of the shade. And yet the menace of the years finds and shall find me unafraid.
Mhm.
It matters not how straight the gate, how charged with punishments the scroll. I am the master of my fate. I am the captain of my soul. I pray this spirit captures the heart and minds of our Hamilton County, and we strive unfettered to work toward a more perfect union together because we are capable of creating the beloved community.
Great.
Thank you very much.
Thank
Great.
you, Commissioner.
Mhm.
So I too want to just recognize, again, it's a celebration, but also a sober moment when we know the passing of John Lewis, that an icon, somebody that we all strive to emulate, has passed away. So his mark is indelible. He was at the forefront of the civil rights movement with many others, but has been able to live long enough to see some of the changes, but not all of the changes that need to happen to make us that beloved community. So I look forward to working with both of you and the county administration to continue to move this county forward into a better space where we are, as our resolution has said, the resolution declaring racism a public health crisis, we can do better, and we are striving to do better as a community. So thank you for that. Also, related to...
I almost said amen on
Amen, amen. So I'm Catholic, so we don't do that.
Amen.
But,
Yes, we do, Denise.
so well, no, that is true. St. Joe's does do it. It's not so much. So also related to Lincoln Heights, I look forward to seeing the resolution. I think all three of us have weighed in on this, and we're all interested to have that moved out of Lincoln Heights. It has been very traumatic over the years for the residents, and so now is the time to address this one. And so I hope that we can work in collaboration with the city, CPD. We've talked about the Coleraine facility, so we'll continue to work on this thing. So I'll look forward to getting that a draft of that resolution so we can all see the language. One other thing that's also rather sobering, we issued an alert today related to the addiction crisis in our community. There are statistical milestones that we must meet in order to issue that alert. Unfortunately, we have met them. Evidently, there were 18 overdose emergency room visits. I believe it was yesterday. So that is a very elevated level. It's an indicator that we've got something going on in this community that is, at an alert stage. And so public health, the Addiction Response Coalition, City of Cincinnati have all issued an alert. And basically what it says is to beware that probably carfentanil, fentanyl are causing these overdoses. It is being mixed into heroin, but also cocaine, also methamphetamines, also other drugs. And so people need to be on the alert, carry Narcan in case you encounter someone that is overdosed. And for those folks that think they are recreational drug users, there is a very dangerous batch of fentanyl, carfentanil in this community right now. And so this serves as the warning to those individuals. We certainly don't want to encourage people to use drugs of any kind, but this is especially concerning because one dose could be the fatal dose. So I just want to bring everybody's attention to that. And then lastly, just want to remind folks, I know this has been in the news, Union Terminal is opened up. Masks on, safely distanced, wash your hands, but they are able to open up because of the space that's allowable there because it's so big, and also the Holocaust Museum is open, and it's just really, I toured it the other day. It's really something to see. So I would encourage everybody to get down there and take advantage of this gem that sits within the city of Cincinnati and within Hamilton County, because they are open for business. All right, so Jeff, let's go to the by leaves. And if you would do the one related to testing first, then we will encourage those that are on the line. I know we'll give them an opportunity to say something about this by leave.
I would be happy to, Madam President. Thank you very much. And I think we may still be trying to loop some of the folks who are here for this onto the call, but I'll go ahead and present the item and then we can tackle it from there. So first and foremost, as the board is aware, the Board of County Commissioners approved a plan for the use of our $142 million CARES Act allocation back in April. The allocation we are using to do a lot of different things as it relates to combating the pandemic in the community, from small business assistance to rental assistance, to the purchase of personal protective equipment, making sure that our facilities are better capable of not serving as hotspots for virus transmission, et cetera. It's probably about 30 different uses that we are using our CARES Act dollars for. And at this point, I'd just like to take a brief opportunity to plug the dashboard that we now have on our homepage at hamiltoncounty.ohio.gov. Folks can go there and navigate to our dashboard, which provides a real-time summary of how we are using our CARES Act funds. One of the things that we, from the very beginning, had recognized was something that we needed to do to ensure that this community was responding to the pandemic as holistically as we could, was to ramp up and increase the amount of testing in the community. So we, as we must do as a public organization, entered into a competitive procurement, received multiple proposals on a testing program for Hamilton County, and over the past several weeks have been in discussions with the Health Collaborative on bringing them on board to increase testing in Hamilton County. And so we have Craig Brammer, who's the CEO of the Health Collaborative, on the call with some of his team and some physicians from several hospitals who are involved with this. And I'm not going to steal their thunder, other than just to say that what we are investing in here is what will be a dramatic increase in both the amounts of testing, our ability to test and educate in vulnerable communities to make sure that we're responding where it is needed, to make sure that we have the ability to help our first responder community, to make sure that we are helping our frontline worker communities as well. And as I'm sure Craig will go into briefly, also to make sure that we are enhancing the robustness of our data collection system around testing in the community. So without further ado, I want to turn it over to Craig as the CEO of the Health Collaborative to talk a little bit about the initiative, and for him to, if he needs to defer to any of his team members, happy to do that as well. So Craig, the floor is yours, and thank you for being here.
Yeah, welcome, Craig. We're very excited to have you and your team on the call today.
Hey, thank you all, Jeff and commissioners. First, I just want to acknowledge your leadership in addressing this issue. You know, the crisis within the crisis of COVID-19 is that, as you see across the country, tragically, the people at most risk for COVID-19 for acquiring the disease and succumbing to the disease are simultaneously often the people who have the least access to testing capacity. And we don't want that narrative in our community. We want to make sure that those at most risk are front of the line and have access to needed testing. So I just acknowledge your leadership on that. I do have some colleagues on the line here. I'm going to introduce just them briefly. Maybe you guys could just wave when I say your name. Kiana Trabue is the Executive Director of Population Health Strategies at the Health Collaborative and a board certified rock star. Bob Coogan is one of our finance guys, and Bob was wearing a tie today, looking sharp. We have Dr. Mike Lyons, who is has a lot of roles, but he's an emergency medicine physician at UC Health and is a professor of emergency medicine, but also runs the early intervention program, which you'll learn more about momentarily. And lastly, Dr. Steve Davis, who is the Chief Operating Officer at Cincinnati Children's. We have
he just froze.
Oh no. Oh no, we only got through the introductions. All right. So Craig, you are frozen on our screens. And I do want to recognize also that Health Commissioner Greg Hesterman is also on the line. So I don't know who Craig was going to introduce first, but maybe you all do. So we're not to ignore Craig, but we're going to move to someone else while he unfreezes himself. So who would like to give us an overview of this?
Hi, everyone. This is Mike Lyons. I can start.
Thank you.
Just the basic goal here, which is with this initiative, we estimate it will be possible to conduct an additional 175,000 tests for COVID-19 infection in Hamilton County. Approximately 35,000 of those will be in the context of outreach directly into the community by our early intervention testing program, specifically targeting populations that are most at risk and most vulnerable. And then the balance of tests, about 140,000, will be accomplished through expanded testing above and beyond current testing in the regional healthcare systems, again, working to target the populations that are most vulnerable and most underserved. Happy to take that just basic foundation, and otherwise, if Craig isn't back online, I think next we would turn it over to Steve Davis talking about area lab capacity.
All right, let's go ahead and do that.
Hello, are you able to hear me?
Could I ask a question to Dr. Lyons?
Yes.
Sure.
So those vulnerable targeted communities, Dr. Lyons, not the whole entire list, but could you just give me a short list of what those communities you're targeting?
So,
Hello, thanks. I guess I can't in that the two issues. One is that we have a very accomplished data analytics group at the Health Collaborative and at Cincinnati Children's, who are the ones that are in charge of assessing the information that's coming in near real time, deciding again where is the least amount of testing occurring and where are folks most at risk in terms of either vulnerability factors or their percent positivity. I am championing the testing core, and in a sense, we will go where they decide. But I don't. Part of our process is setting up the systems and make those decisions in a very responsible way, but also setting up those systems so that we can adapt and change as frequently as we need to stay on top of what's going on in real time.
Okay, thank you so much.
and hi, this is Steve Davis. I'll just follow on that with a couple of points. Probably the most important point is that it isn't just more testing, it's testing the right people at the right time at a location that they can actually get to. And, I'll give you an example of when testing doesn't help. There have been some cases where there's a person who is COVID positive and who is at a workplace on a Saturday and exposes a dozen people on that Saturday, and they all go on Monday to get tested. And not surprisingly, they're all negative because 2 days is not enough time for that to get the virus from that person. But then people walk out thinking, okay, I'm negative, so I'm good. 5 days later, when they start either having symptoms or are asymptomatic, they may infect others. So it's not just increasing the volume of testing. It's really important to know our goal is to test the right people at the right time in a location that they can get to. One of the challenges that you may know is we have had large volumes of testing overwhelm some of our labs, and we've seen turnaround times really be delayed at times. And you know, Greg Kesterman's job is already hard enough. If it takes 5 days for a lab result to come back, that really doesn't help anybody. And so we will also try to make sure that we know the day-to-day capacity of all the labs in the region. And when we go to a location and do 500 tests, we'll make sure that we send them to the labs in a manner that they'll be able to get quick turnaround time. I can stop there and see if there are questions on any other topics.
Well, why don't we roll through and listen to the others that want to present on this from the team?
Sure, I can chime in here. Good afternoon, everyone. Kiana Traby with the Health Collaborative. Wanted to just talk about the community engagement piece of this project, which is really critical. We have a plan in place to identify community-based organizations, community leadership, neighborhood leaders to join us in this effort to help us understand where are the best places to go in neighborhoods, who are the best people to engage. In addition to that, really focusing on equity throughout this entire process, making sure that our efforts are culturally responsive. So we're excited to be able to partner with some community organizations that can help us connect to communities and with communities to make sure that how we're delivering the testing, how we're communicating about testing, how we're communicating about results and what people need to do, as well as understanding what additional resources individuals may need as they're either waiting for results or as they have been tested positive, to make sure they have access to social service agencies and resources so that they can successfully recover once they have been tested positive.
Mm-hmm. Thank you. Mm-hmm. And I'm going to ask someone to elaborate on some of these partnerships, but let's get, I think there's at least one more speaker. I think it's Mr. Coogan, I believe. So I know Bob Coogan is part of the team. There we go.
Yeah, guys.
We were muted. Yeah, there we go.
I'm here more to be some support if there are financial questions. I didn't have a speaking role, so to speak. So.
Oh, you're the finance guy. All right.
I am. So I'm not just speaking in front of crowds. So I'll turn it back to Craig.
We're a nice crowd. So far, so good anyway. All right. So Craig, I know you bumped off, but we did hear from everyone. Thank you for the intro. So, you know, essentially, I think what we're hearing is that this is a major effort in partnership with the county and all of the folks that are on the line and others, including the hospitals in our area, to make sure that we are ramping up testing, particularly in congregate settings and vulnerable populations. And so we heard a little bit about partnerships. So could we expound a little bit on who or wait a minute. So Greg, are you weighing in on this as well?
I'm just here from a public health perspective. If there's questions, I've played a major role in helping with drafting some of the language on the county side.
Okay, thank you for being here. And I see that Lisa Webb is also here, and I know Lisa had a role in getting this together as well. Thank you, by the way, for all the work. I know when you're dealing with $19 million, it can be challenging to get that contract language just so. So thank you all for internally and externally for doing all the work to get this thing rolling, because we're anxious to get it out into the community. So let's talk about community partnerships. If we could just elaborate a little bit on that.
Yeah, sure. Let me start by just talking about the on the provider side, and then Kiana, I'll ask you to talk about some of your early work. So on the provider side, we were very committed to making sure that this was a whole of the county approach, and that everybody had not only an opportunity to participate, but felt a sense of commitment and obligation to our community. And thankfully, they've all accepted that challenge. So our primary partners are the University of Cincinnati in the Early Intervention Program, Dr. Lyons Group, UC Health, and Cincinnati Children's. Then in addition, pending contract approvals, we have Christ, Tri-Health, and Mercy. So essentially the whole of the delivery system is locking arms and ready to rock and roll on this. We, when the pandemic hit, you might be interested to know that the chief medical officer and the chief operating officer of every major health system met every morning, including weekends, at 7 o'clock, and has continued to do that. We only do it 3 times a week now, but Dr. Davis and his colleague from Children's and all the other systems. And it's been an absolutely heroic effort on our behalf. You know, we had a call last week with Secretary Alex Azar in DC because he had caught word of the way that we've organized as a community and wanted to learn more. And so it's just a huge honor to be part of that. We now have a multi-agency coalition that includes a steering committee of the hospitals that I just referenced. That group has 2 co-chairs. A similar group for public health that Commissioner Kesterman is on. It's all the health commissioners in the region. And another one that represents congregate living, which we have about 400 facilities, nursing homes, treatment facilities, and the like. And together, each of those have multiple subgroups. So we estimate there are about 300 people involved in this response, and all hitting it hard nights and weekends. We then have this parallel partnership that you're aware of with the Chamber of Commerce and others, the CBC and CRBC, around the business response to COVID-19. And so we are working hand in glove with that group. So we're representing the health response, and they're representing the business response. And recently we launched the Regional COVID Communications Center, as we call RC3, to help make sure that we don't fall into this trap that a lot of people in the country have fallen into, where there's like competition between pro-business and pro-health. That's a false dichotomy, and we don't want that in our community. We want to talk with one voice and work in concert with each other. So it's through that already pre-existing coordination that we were able to pretty quickly turn this, respond to your request, and make sure that we involved everyone. Kiana, you want to talk about the partners? We haven't notified them yet because we haven't been able to talk to other people outside the group. But I know Kiana is chomping at the bit to really get going.
Sure. Thanks, Craig. So we have intentions to partner with organizations, as I mentioned, that have demonstrated commitment and relationships and engagement across the county and across the different neighborhoods. Some examples include Su Casa for connection to the Latinx community, the Center for Closing the Health Gap, who's been doing a lot of work around making sure that the response efforts are equitable, and has also been involved with making sure testing sites are available across the county. In addition to that, the Urban League of Greater Southwest Ohio, who's also done a really great job of helping to distribute PPE and other resources for those at-risk populations that have been identified before. Others include United Way of Greater Cincinnati, their connections to social service agencies to ensure that those wraparound services and resources are available to the community. In the YMCA of Greater Cincinnati, who has branches located across the county that could potentially serve as testing site locations, but then also the connection to their membership base. Those are some examples of organizations that we'd like to approach and subcontract with for this work that we believe are going to be critical for the success of the project.
Mm-hmm. So do you anticipate not only vulnerable populations related to some of what we're seeing in the Latinx community and the African American community, we also have some hotspots, and Greg would attest to this, that are more driven by geography. Do you expect to have partners out in the community that are related to certain areas of the county?
Sure, absolutely. And part of that will be driven by the data. The way that we're approaching the community partners is thinking about who the core partners are that we need at the beginning to help us plan out and design what this looks like, and then bring on additional partners throughout as we determine the geographic locations where we need to be testing and engaging.
Okay, great. Thank you. Commissioners, questions?
I have no questions. Thank you for all your work and what you're getting ready to do.
Thank you.
I'm sorry, I have no questions, but this is really smart, and just thank you. I'm glad that we have formed this partnership, and I look forward to working with you as we fight this plague together.
Thank you.
Sienna?
If it's all right, I would let me add just one other component that I don't think was addressed while I went on hiatus for a minute. This community is quite unique and nationally recognized for leveraging health information technology and data in clever ways. Ours was one of the first communities in the country 18 years ago that started moving clinical data electronically between providers and hospitals and doctors. We now at the Health Collaborative move about 15 million clinical results a month across 10 large health systems, 10,000 physicians, providers, and have about 4.5 million lives in our identity management platform from north of Dayton down in the middle of Kentucky to Bloomington and out east. And so we have a unique opportunity to leverage that infrastructure and already have. For example, we have access to all the laboratory data and including the commercial labs like LabCorp and Quest in real time. And so every morning at 7 o'clock when we review these data, we're getting these data even sooner than the state health departments. And, in this situation, 24 hours is a lot of time to help us know if we need to launch the convention center or what have you. So this project will take advantage of that infrastructure, the technology and talent, and allow us as a community, I believe, to really set the pace for a regional countywide surveillance system that will serve us all well and help us make sure that we're precision focused on these testing resources. And so, that 30-page dashboard that we review every morning includes very detailed census tract analysis of hotspots in as real time as you can get.
Great. Yeah, no, the Health Collaborative has done a fantastic job in partnership with all of the hospitals and others to make sure that we have a coordinated response to COVID-19 in many, many different areas. So thank you for doing that. We are excited that the partnership is with the Health Collaborative and all the other partners that we just talked about. So I do want to mention internally this is a lot of money to go out, not only to this purpose, but we've got these CARES Act dollars moving out to meet the needs of a variety of things in the county. Testing is so critical, and so it's one of our number one priorities, and the dollar amount matches that. So I want to thank those who, as you say, have been working really 7 days a week, trying to get these contracts in order so that we can get the money moving quickly out into the community. And so some of those internal folks, Greg Kesterman is one of them, Holly Chrisman, Cindy Fazio, Lisa Webb, who's on, and James Sires. So Jeff Aludo as well, of course. So thank you so much to your team. Thank you to our team for, I know this was a mad dash here at the end, but we were very, very grateful because we've got a little bit of gap in time here between the National Guard pop-ups and this rolling out. So we're trying to fill that gap, and we've got a pop-up. Actually, Greg, help me. It's in Forest Park on, I believe, the 5th.
August 5th, noon to 4.
Noon to 4. And the location is?
I do not have that handy.
The United Methodist?
That sounds right.
Yeah.
And we did just today get commitment for 3 more sites. I don't have those details yet, but the Guard did commit. So we'll have testing throughout August.
Very good. So what we're trying to do is provide some continuity in testing for the community. So we're going to try to fill this small gap, but so grateful that you all were willing to put in the effort and the time and energy to get this thing rolling as quick as we could. So thanks again. We're really looking forward to it. And we'll be interested to see where you land. I know it's data driven as far as where you're going to end up doing the majority of the testing, but we'll be very anxious to get an update as we roll through this. So Thanks for getting on. Thanks for what you're doing in the community. We're very, very grateful.
Thank you.
Thank
So-
you.
Thank you.
So commissioners, this item on your agenda is by leave number 8.
Yes.
And so just before I recommend it formally for passage, I again just want to thank Craig and his team for all they've done. As he said, they've, and I got some of the photographs of his team working weekends and beyond to make sure that this gets done, as did members of our staff. But I do just also want to thank Craig and all the members of the Health Collaborative organization. They did this during what I know were some very organizationally challenging times as well. So we're really fortunate to have them here in the community to take the lead on so many of these public and private health related issues. And I can't think of a better organization to lead the charge for the county on a testing related issue. So with that, commissioners, I recommend by leave item number 8, which is the resolution executing an agreement between the Board of County Commissioners and the Health Collaborative for COVID-19 data testing and data collection.
All right. So I will move then that we approve of the resolution number P079-20, authorizing the award of RFP number 047-20 and execution of an agreement between the Health Collaborative and the Board of County Commissioners for COVID-19 testing and data collection.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Park?
Yes.
It's official. Thank you. Thanks, Craig.
Thanks, everyone.
All right, Jeff, why don't we go ahead and move through the rest of these by leave?
Yeah, so we'll go back to item number 1. I know we have some folks on the call for this as well. So this is by leave item number 1 in your packet. This is resolution number 19, appointing the Hamilton County dog warden and deputies. As the board is aware, we've been working for quite some time on the shift of a paradigm related to how we handle animal care and our state required responsibilities related to the dog warden as it relates to sheltering and housing of animals, the enforcement of licensing and strays, even our adoption and foster programming as it relates to animals, and as well as the ancillary humane work so important related to this function. So I'm very pleased we can take this step today to recommend a contract, which again, as we said, is a bit of a shift from where we were. Cincinnati, I know that we recently went through a name change, I think, from the prior name to Cincinnati Animal Cares Humane Society. Carolyn, did I get that correct, or was I off by a word?
No, that's correct. Cincinnati Animal Care Humane Society. And I've got our chief warden here too, if you wanted to start with the appointments. I wasn't aware that we were going to do that, but he's in another room in a meeting, and I just brought him in here in case we do want to start with that as well.
Oh, so I think what we'll do first is recommend the contract. So we do have Carolyn Evans with Cincinnati Animal Cares Humane Society. So commissioners, at your deference, I'd like to just defer to Carolyn for a moment, just to talk a little bit about the initiative and where we're going from here.
Okay, that sounds great.
Well, our team has been operating in Claremont County for the last 3 years to great success, and we are really looking forward to expanding our life-saving footprint into Hamilton County. We're excited to work with the county here and appreciate your bold commitment to animal life-saving. I think it was time for a change. We are aware that SPCA made a decision to focus on other areas, and we wish them well. We really are thankful for them for carrying the torch for so many years here in Hamilton County for 60 years, really making change for animals in the community and starting to, along with the rest of the country, move from the days of the dog catcher and the dog pound and really begin to focus on animal life saving and to support programs that help keep animals in homes with their families. So we're looking forward to doing that in Hamilton County.
Thank you. I see that John Brugan has joined. John, do you have anything to add?
no, I just want to thank everybody for this long road, and I'm glad we're here and excited to kick everything off on Saturday.
Well, John, you were the organizer of the group, so thank you for your work. I know this has been a long road, but thanks for your diligence on this one. Really appreciate it.
Well, yeah, I would say it's been a quick transition, a rather quick transition, and we appreciate everything that John and his team and Jeff and even the facilities folks have done to help try to make it a smooth transition as well. There's a lot of work to be done, but we appreciate all your support.
Thank you.
And commissioners, the resolution in front of you actually does two things. It appoints the Hamilton County Dog Warden and deputies. And Carolyn, I didn't want to cut you off earlier on. If there was someone else on your team that you wanted to introduce, I'm happy to do that. Or if not, that's fine too. But if people were available, just wanted to defer to you on whoever you wanted to introduce in this time.
Yeah, we're having another meeting. I've got someone in another room, but I did bring our chief warden in for a moment because I heard you say that you wanted to do the dog warden appointment. So I can bring him in here if you'd like to do that, or if we need to cover something else first.
It's not formally necessary, but if there's just something you wanted to have him say, that's fine. But otherwise, we could move forward with the resolution. Madam President, I'll defer to you.
Yeah. So Jeff, I wonder if maybe it would be best to bring the new dog warden into a staff meeting, so that we can meet him, we can hear about his expectation for the work. And as you said, this is a bit of a paradigm shift for us. It's kind of a big deal. And so I think it might be worthy of some conversation in the staff meeting.
I think that makes sense. That would give us a little bit more time as well.
Yeah, okay, let's do that. And we'll schedule it for, a few weeks out. Commissioners so Jeff, just as a point of clarity, so by leave 1 is by leave 10, then also wrapped up in this.
Sorry, let me find my paperwork here. By leave 10 is actually the contract itself. By leave 1 is the appointment of the dog warden and deputy. So both, so you can take both of them together.
Yeah, I think we'll take both of these items together. So commissioners, any comments or questions?
Thank you, Madam President. I met Carolyn a couple months ago, and her crew, and I was really excited about their excitement, and started looking at the SPCA issue when I first started as commissioner, maybe 3 or 4 months in, and felt there needed to be a change. And so we as a group, as a commission, looked at it, worked through it. It was a hard change, and I agree, Carolyn. I also thank the SPCA for all their diligent work for all those years, but I'm just really elated that we're at the point that we are now, that we're getting your group involved to do some additional services for our animals and high quality services. So I just want to thank you. I met Troy before. I was trying to take him when I was on the virtual meeting, but I'm glad that we have him as part of our staff there. So thank you.
Thank you. I want to say also that we appreciate and acknowledge your leadership on this matter, and really taking a bold move. Again, it was when I mentioned it was time for a change, it was a decision that SPCA made to shift their focus, and they're shifting to an important focus of humane education. So we're happy to have another humane society in the community that we'll be able to collaborate with. But our team is ready. We're excited about the change. I know that you've got a lot of feedback from the community over the course of the last year, and I'm really encouraged knowing that you heard them. Their voices were heard, and you listened, and you're taking bold and decisive action, and that's really demonstrated by this new partnership and a commitment to animal life saving. So we thank you for doing that, and we look forward to partnering with you.
Thanks.
Commissioner Parks.
I'm sorry, Commissioner Parks.
Yes, it has been a long road now, and I'm glad that we are at the finish line. And John, thank you for everything you did. This was your baby, and you're welcome.
Well, I think we gave him the baby. It's like we gave it to him. He didn't know if he wanted it or not, but he took it and took care of it and nurtured it, and just so proud. I agree with you, Commissioner Parks.
So that's all.
Okay, I
So
hope you guys
Commissioners,
can hear me.
I'd recommend the approval of items by leave item 1 and 10.
All right, thank you. And before we do that, I do want to shout out to the SPCA for all the work that they've done in the past related to the animals and the protection of animals in our community. Can you still hear me? I feel like I'm cutting out a little bit.
Yes.
Yeah.
we can.
You can. Okay, good. All right, I'm going to move that we approve then of by leave item number 1, which is the resolution 19 appointing the Hamilton County dog warden and deputies.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
And also, I'm going to move that we approve of resolution number 20, authorizing the county administrator to execute a $1.95 million contract with the Cincinnati Animal Care Humane Society for Animal Services.
Second.
Commissioner, that is by leave 10, resolution 20. Yes.
Yes.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Very good. Thank you. And thank you for being on. We'll look forward to seeing you at another meeting.
Yes, thank you for your time. Thanks for putting your trust in our team. And I just want to put in a plug that we're having an opening event on Saturday at 11 o'clock at the shelter. The community is welcome.
Wow.
Thank you.
Okay.
Outdoor. Thank you.
Mhm.
All right, Jeff. Thanks, John.
Thank you, Commissioners. Now we'll kind of get back onto an ordinal schedule here. So by leave 2 is a resolution approving and authorizing a substantial amendment to and filing the 2020-2024 Consolidated Plan, 2020 Annual Action Plan. This is a community development oriented item. This is required to account for the receipt of the additional community development block grant and emergency shelter grant or emergency solutions grant dollars that we have received through the CARES Act. So Joy Pearson is on. If there's any specific questions on the item, the administration recommends approval.
All right, Commissioners, any questions for Joy or Jeff?
I have no questions.
No questions. Thank you.
Nice work, Joy. All right, I'm going to move that we approve of the resolution approving and authorizing a substantial amendment to the filing, the 2020 to 2024 Consolidated Plan 2020 Annual Action Plan.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you.
Thank you, Commissioners. By leave item number 3 is a resolution amending Hamilton County's CARES Act plan. We are recommending, back again, as we said earlier when we were talking about testing back in April, the board approved a plan, an overall plan as to how we would go about spending our CARES Act dollars. We are recommending the amendment of that plan to move $2 million from the unallocated reserve into the rental assistance program. The rental assistance program, as you have been updated, has in the very first day of its existence received approximately 2,000 requests. So it's been hit really hard. The dollars associated with the 3 contracted vendors we have will expire almost immediately. So we want to get that program ramped up with some additional dollars. So we're recommending $2 million in addition to the we have got the additional $1.5 million that we can allocate from the rental assistance program itself to that effort as well. So we want to try to get as many dollars as we can into this program given the need. We're currently working with the 3 vendors, Community Action Agency, the Free Store, and Talbert House on the rewrite of their contracts to allow for this expansion. That will be coming forward to the board shortly. So the administration does recommend approval. The other item that is associated with this, it relates to $2.3 million. There is $300,000 that in the initial plan we had talked about allocating $2.3 million to the pandemic child care program. The initial resolution that was done only allocated $2 million towards it. So we just want to make the formal allocation consistent with what the plan was. So there's $2.3 million here, $2 million going to increase rental assistance and $300,000 for pandemic child care support.
Thank you. All right, so I'm going to elaborate just a little bit related to the math. So commissioners, because every time we change our CARES Act allocations, we have to do these resolutions to amend. what we agreed to. So recalling back, we had 5 million allocated for rental assistance and eviction prevention. The eviction prevention is so closely tied to rental assistance that those that were involved in that portion of the funding said that they would rather have it go to rental assistance so that people don't end up in eviction court. So we all agreed that that made sense. And so that 5 million then will be totally allocated to the rental assistance. 3.5 has already gone out the door. We had 2,000 people call the first day for this. So we were clearly going to run out of money, and I think we have run out of money. And so this is the rest of the 5 and an additional 2 to go towards rental assistance. Now, when asked, about whether or not that's enough, the answer is we don't know. I mean, we just don't know what the need is, but we know we need to do more. And so this is an attempt to try to put enough money there to address the need we know exists. If we need to come back again, I just kind of forewarning, we may have to do that given the number of calls that these agencies got. But at this point in time, Jeff, I don't want to put words in your mouth, but administration thinks that this is enough right now, but we might have to come back at some further time and reallocate dollars again if we see an increased need in this bucket.
Yeah, I think your answer earlier was exactly spot on. That is, we don't know. It's certainly enough to keep the program up and running and to provide care to and rental assistance care to additional individuals. So we know that our CARES Act budget is becoming strained. So we want to try to put as much as we can into this, given the heavy demand. What we're also working with these 3 vendors on is an exploration of whether we can tie some wraparound services into this as well. We know from experience now that many of the folks who are calling for this aid are calling specifically because of hardships they're receiving. They've experienced on primarily from an employment perspective. The folks I've talked to have talked about just the sheer number of people, especially those associated with the hospitality industry, either hotels or restaurants, things of that nature, who have lost their job, have never been unemployed, want to get back to work as quickly as possible, but recognize now that they may need to transition in some way, and they just simply never had to do that. So I've been talking with some of the folks from some of our vendor organizations about how we might be able to structure some flexibility into these agreements to allow for a very seamless transition. We don't want to be in the business of telling people, okay, now you got to call this number, you got to call that number. But if we can immediately and seamlessly pivot to not only providing you rental assistance, but also getting you hooked up with some level of job training or instruction to allow you to pivot into another area where you can get back to work as quickly as possible, so that you don't need to be coming back for rental assistance in the future. So we're looking at that. It's not without its complications in terms of getting that to happen seamlessly, but we've got some great partner agencies we're working with, and we may be bringing forward a recommendation to the board on that at a future meeting as well.
Okay. So just a reminder to anybody that's listening, the CAA, Free Store Food Bank, and Talbert are the agencies with whom we have partnered to get these dollars out. So if people are in need of rental assistance, they should contact those agencies, or rather one of them. All right. Are there any questions or comments?
Madam President, just one comment. I wanted to acknowledge the clerk of courts, Aftab Puraval, who gave the money back to Hamilton County from the eviction court for the assistance of rental. You did indicate that it was given back, but I want to indicate that he was the one who made that unselfish decision. So thanking for that.
Thank you.
Thank you, Madam President. I'm really proud and happy that we're doing this. And I'm sorry that all of this money is needed, but we are attacking a problem before so many of our residents lose their homes. So my prayer is that it really plugs that hole and helps people. This is important. And I also think that it was smart to redistribute the money from eviction to rental assistance.
Yeah. Thank you. And thank you for reminding that AFTAB and Greg Landsman too has been on the forefront of that eviction issue. And thank you to both of them for their ongoing work with the issue. All right, I'm going to move that we approve of by leave 3, the resolution amending the Hamilton County CARES Act plan.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you.
Thank you, Commissioners. So the next item is by leave number 4. Updated the board on this previously. This relates to the relatively urgent need for us to migrate our email system for many of our board and some non-board departments as well. We've Andy Knapp, who is on the line, who is our Director of Communications, has led an internal work group of IT professionals in board departments and outside the board to look at multiple recommendations on the best way to migrate our platform to a supported environment, and one that will improve functionality and efficiency for all the departments in the work of Hamilton County. So the recommendation is to move to a Microsoft Office 365 solution that will be an annual contract of approximately $250,000, which is split between restricted and general funds. About $100,000 of that is restricted funds. We're looking at about $150,000 to the general fund, but for a markedly improved and supported system that should, as I said, improve the functionality and the convenience and efficiency of our employee base as well. So the administration does recommend approval of this item, but I do want to defer to Andy Knapp for any comments he might have on just the recommendation to move in this direction. And any other thoughts just on the Office 365 platform as a solution. Andy?
Good afternoon, Commissioners. I appreciate the opportunity to present this this topic to you, and I appreciate your leadership on this this issue. This upgrade of the platform is necessary in that we are several versions behind, if you will, on our email platform, and in fact, Microsoft is phasing out the particular platform that we're on currently. So that brings a sense of urgency even a little closer home in that we have to get off this platform for the cybersecurity needs of the county. As you can imagine, the productivity of each and every one of the county employees and trying to do the work to the residents of Hamilton County rely very heavily, just as you folks do, on email, and the reliability of our email system, the resiliency of the email system, and obviously that availability of it is quite critical. This upgrade essentially moves a majority of the overhead, if you will, of the hardware and the infrastructure from the county to the Microsoft company, quite frankly. And it's something that many government entities around us, we've done a fair amount of due diligence. There are the entire state of Ohio Department of Administrative Services, for example, is on this exact platform. In addition to the email upgrade, this then also gives us all of the productivity tools that many of corporate Americans are used to having at their fingertips, and especially in these times as we are operating from remote locations and not always in our office. You need to have access to your files. We need to have access to the tools that keep the employees productive. And this is a step in the right direction. We established under the leadership of the Assistant County Administrator, Holly Chrisman, we had established a committee of folks who are directly impacted by this email. We gave them a variety of options. We laid out not just the options and the software and things like that are available, but also the finance behind it, and recognize that, again, this is a step towards increasing the productivity of our entire workforce and all those that rely on the email platform so heavily. So if there's any specific questions, I would be happy to answer them for you. If not, I appreciate your support.
Thanks, Andy. Are there questions or comments for either Jeff or Andy?
No questions. It's very much needed. Thank you, Andy.
Hi, Andy. No questions. Thank you.
All right, very good.
So Commissioners, this relates then to by leave item number 4, and that's the budget adjustment to allow for this, and by leave number 5 is the actual contract with Microsoft.
Okay, so I will move that we approve a budget adjustment number 27, $250,000 in contracts and subsidies to address email.
Second.
Commissioner Dreehouse,
Yes.
Commissioner Summer Dumas,
Yes.
Commissioner Parks.
Yes.
And also, I'm going to move that we approve of the resolution number P078-20, authorizing an agreement between Microsoft Corporation, CDW, government, and the Board of Hamilton County Commissioners on behalf of the Communications Center for services to replace the county email system and providing current licenses.
Second.
Commissioner Dreehouse,
Yes.
Commissioner Summer Dumas,
Yes.
Commissioner Parks.
Yes.
Thank you. Thanks, Andy.
Thank you,
Thanks.
commissioners,
Uh-huh.
and thank you, Andy. Great job. The next item relates to the Hamilton County Development Company. This is a contract amendment. So when we initially entered into an agreement with HCDC for carrying out our small business program, we placed in there a provision, and Pat Longo is on from HCDC. He can provide us any further detail, but a provision that said that they would operate the program through July of this year. Not quite sure what we were thinking when we put July of this year.
We're being optimistic.
For our small business program, but obviously this is something that we need to address to provide them the ability to handle this program throughout the year. Pat, anything else you want to say about this particular item, and anything else you want to say about the small business program? You guys have been doing a great job implementing it.
Well, thank you, Jeff, for the positive comments, and thank you, commissioners, for working with us and helping our small businesses. Appreciate your leadership on this. Yeah, extending the date till December 30th is going to allow us some flexibility. I think we have 6 grants that still need to be funded out of the first batch. And I'm excited to say that we've been making contact with all of those to get the information we need. So I think we're about done with the first phase. And I know that we're in conversations with Holly, Chrisman, and community development, and to get kind of the framework for the second version. You know, that's going to go out, and that's great. And then also to go out and start to sell and promote it and make sure we get good feedback from, you know, all the different networking groups, the various chambers, you know, business assistance groups, that sort of thing.
Great. Yeah. And just to put a finer point on it. So as we've talked about before, we served just around 200 small businesses in the first round. Hit our target of very small businesses, 50% minority owned, 50% women owned. And so I think that's something to be proud of. But the criteria eliminated some folks that I think we would like to still try to capture. And so the administration's working on changing the criteria. We have some dollars left in the program to allocate to this. And we know there are still some small businesses struggling out there, but didn't qualify for one reason or the other. So thank you for your work on being flexible with the criteria. We look forward to what you all come up with after you've talked to some of these business owners. And so looking forward to the continued work with HCDC. So questions or comments from the commissioners?
Thank you, Madam President. And thank you, Pat, for what your agency has done in working with our administration. Great job. The allocation was great. I'm a little confused, though, when we say 50% minority and 50% women. I'm sure there were some Caucasian males that possibly got a grant, or how do we? Yes. So where's that percentage?
We're about 50% combination either minority or women. You know, with a very sizable number of them being minority women. You know, in the allotment. So we'll be able to get you that number. I don't know that off the top of my head, but I do know it's a very significant number.
Okay. And I also appreciate your flexibility, as the president has said, as it relates to looking at what went well and what didn't go so well, and trying to alter that so more people can qualify. And you were saying, Pat, as you talk to other people to bring out that second round, are you thinking, 3 weeks from now? How soon do you think we would start that second round? You and Holly have talked about it.
I think we've been looking, and Jeff, you may have a little bit of knowledge on this, looking somewhere probably around the 10th of August, somewhere in that range. I don't have exact, but yeah, that's, and not only are we talking to people in our community, but we're also talking to folks from other cities, to see what might be working, because I don't think we're the only ones that are doing a second batch.
Sure. Okay, great. Thank you.
Commissioner Parks?
Thank you. Hi, Pat. And thank you so much for all of your work. It's been a great partnership, and we are truly helping small businesses. So looking forward to round 2. And,
Thank you. Thank you, as are we.
Yeah, so keep up the good work.
Thank you. All right, I'm going to move that we approve a resolution authorizing the county administrator to enter into a second amendment to the service agreement between Hamilton County and HCDC, Inc.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you.
Thank you, commissioners, and thank you, Pat.
Thanks.
Our next item is by leave 7. This is a budget adjustment number 28. This is a $748,400 grant to the Board of Elections. This allows the Board of Elections to receive CARES Act grant funds from the state of Ohio, from the Secretary of State, to help offset fall election costs. This is simply receiving this grant and appropriating and allocating it. John, anything else that we need to know about this at this point?
No, you mentioned this is the fall election. The good news is they also got a little bit more money recently from the Secretary of State for the primary election.
Great.
Great.
All right. Any questions or comments?
No questions or comments.
Yeah, thank you.
Very good. All right. I'm going to move that we approve of the budget adjustment number 28 for $748,400 for emergency grants to the Board of Elections.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you. We've got one left, Jeff.
Thank you, commissioners. And I think, well, I'm not sure if Lisa is still on or not, but, oh yeah, I think Lisa Webb is still on. But this is a resolution authorizing the administrator to enter into an agreement with Strategies to End Homelessness. Kevin Finn, I think, is also on. This is an additional $500,000 to continue our ability to shelter folks from the congregate homeless shelters in the community, in facilities like hotels and motels, to ensure that those congregate facilities do not become a grounds for hotspots and virus transmission during COVID-19. So with that, I'm going to turn it over to Lisa to talk or Lisa looks surprised. I don't want to surprise you, Lisa, but anything additional you want to say about this before we kick it to Kevin?
Sorry. No, I have no issue speaking on it. I just was surprised.
Okay.
Yeah, so this is an additional $500,000 using CARES Act to provide for temporary hotel, motel beds for the shelters while we work to figure out what else we can do to safely transition people back into shelters. And this should extend into September while we look to develop our next steps to move forward.
Thanks, Lisa. Kevin, are you still on?
Yes, I am.
Kevin, anything you'd like to say about the ongoing partnership on this?
Well, I'd just like to thank the county for even considering this. We had 7 shelters at first that, when the pandemic really got bad, were not in a position to take care of people within their normal facilities. So we had 7 shelters that had to close in whole and move people into hotel and motel rooms. Since then, 2 of them have managed to reopen. A third is operating at sort of a reduced capacity currently, but we have 4 shelters that are still completely operating using hotel and motel rooms. And it just so happens that those are our 4 family shelters. So these are dollars that will literally pay to keep homeless families safe in hotel and motel rooms through September and into October. You all providing this funding will also allow us to potentially preserve some other CARES Act dollars that are still coming down the pipe and haven't arrived yet to use for housing. Every homeless person would rather be in an apartment than in a shelter or a hotel room. The presence of these dollars allows us to not only make sure that these families are kept safe for the next couple months, but also that other resources that are yet to arrive will actually be available to help those folks actually get back into their own housing over the next few months and before the end of the year.
Great. So Kevin, as far as the retrofitting for some of the shelters where folks have been able to go back, can you give us an update on that?
To the best that I can, I'm happy to. I have not, there's been a lot of conversation about a number of facilities that are serving different people in different sort of disadvantaged positions. I am most directly involved with the ones that are very specifically emergency shelters. So as I mentioned, there are 5 facilities there. We have 10 homeless shelters in Hamilton County. There are 5 that are currently utilizing hotel and motel rooms. And the reason why they're still using hotel and motel rooms is specifically because they have not yet had access to resources that would allow them to make improvements to their facilities that would allow them to return. So they need some resources to be able to put partitions between beds to reduce the amount of bathroom sharing and different things like that that would need to be done. Some HVAC type issues to make sure the virus isn't being spread. But, my involvement has basically been with those 5 emergency shelters. Now, there are other facilities in the county that have been a part of the discussion that could also benefit from improvements, but many of those other facilities, either one, are not a homeless shelter, or 2, they're not currently being forced to do hotel and motel rooms. Like the situations in their facilities is not so extreme that they had to close them and move everybody out somewhere else. So I can't necessarily speak to all those other facilities.
Okay, but we are working to retrofit some of these facilities so folks can move back and out of the hotel rooms.
Yeah, and I would encourage you that, it's a great thing that you all are willing to consider providing the money for the hotel and motel rooms, but those are somewhat a necessary evil right now in the midst of a pandemic. It's a very expensive way to provide people with shelter. Mm-hmm. So I would encourage the county to move those 5 facilities that are doing hotel and motel rooms right now because their congregate facilities just aren't safe, to move those 5 to the front of the line, because the sooner we can make improvements to their facilities, the sooner we can stop spending money on hotel and motel rooms and redirect those funds toward apartments, which again is what every homeless person really actually wants.
All right. Well, we'll talk to you offline about how to further that conversation. So thank you for the work that you're doing. Yeah.
Just very briefly. So Lisa is running point for us on the conversation with the Homeless Coalition on the facility retrofit issues. So we met this morning about it. We're looking at the next step. At every step, we're really asking ourselves the question of ensuring that what we're doing makes sense from a public health perspective. We want to make sure that if we're going to invest money from a capital perspective in these facilities, that it does have the long-term benefit of ensuring that if there's another incident like this, it legitimately does allow them to keep more people in the shelter versus sending, as Kevin said, sending them to hotel and motel rooms. As much as we want to invest in, water efficiency and energy efficiency and things like that, that's all good stuff. But what we're doing has to have a health benefit. And what we're seeing right now is that for the most part, we're aligned with public health that these improvements would. So we're taking the next step to ensure that we can move forward and keep progress moving on looking at some retrofits to make sure that these facilities are better set up to be resilient in this pandemic as it continues and in future pandemics as well, if they were to happen.
Great.
And thank you for the lead in there. I will say I'm actually jumping off of this call to get on another call with public health, community development, and facilities to talk this exact issue.
Great. Thank you.
If I might add one last thing. Just can't thank you all enough for considering this. Really, if they were in their right mind, Jeff Ludo, Joy Pearson, Lisa, Jen Ketter, and Holly Chrisman should all block me on their phones and never take my calls again. They have been unbelievably good to work with.
Oh, that's great. Thank you.
Thanks, Kevin. Good job.
Yeah.
Thank you.
Commissioners, anything?
Yes, I have something. Kevin, I heard you talk about the 5 facilities that you're partnering with. And and that the money, this money that we're allocating will last maybe through the first couple weeks of October. But what about the homeless that are on the street? How are we helping them that have not been in a facility?
You've noticed something that is definitely an occurrence. What we have right now is we normally have very low numbers compared to the rest of the country of homeless people who are sleeping outside on the street. We are in fact seeing an increase in the number of people who are sleeping out on the street right now. And that is in part because of what is going on with these shelters, with them having to change to using hotel and motel rooms. All of their intake processes have been disrupted and how they get people into their shelters. Some of them have had to temporarily reduce their capacity. Some of them do not, while using hotel and motel rooms, some of these shelter operators do not have the same degree of flexibility to fit someone else. Like they can always sort of make room for one more in a congregate facility, and they just can't do that in hotel motel rooms. So we are in fact seeing more people on the street because the shelter system has sort of been stood on its head by the pandemic. If we can make some of these improvements to the shelters, get them back into their normal operations, then those folks who are currently out on the street because they can't seem to get into a shelter will have a much easier time getting in.
Okay.
So it may seem counterintuitive, but the way to address that issue on the street is to fix the issue with the shelters.
Retrofit the shelter.
Yes.
Yeah. Okay. All right. Thank you.
No questions. Thank you.
Okay, great.
Thank you.
All right. Without further ado, I'm going to move that we approve of by leave number 9, resolution number 17, $500,000 resolution authorizing the county administrator to enter into an agreement with Strategies to End Homelessness.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you, commissioners, and I believe that completes my by leaves for today.
I believe so, Jeff. You took up a good portion of our meeting.
Yes, I did. Yes.
You know, it's the nature of meeting every other week, I think, that
Right.
we have a lot more by leaves than we used to. All right, we've got one regular
Madam
agenda
President.
item. Oh, sorry. Yes.
I'd just like to thank Jeff and also John Brugan and also Tim McCarthy, because I had a few questions as it relates to the by leaves, and they sent back some clarity for me, and I certainly want to thank them for that. Thank you.
Happy to do it.
Very good. All right, so we've got item number 1. Is the engineer on? Is Eric on? There he is.
I am
All right,
here.
very good. Hi, Eric. How are you?
I'm doing very well, thank you.
Good. Talk to us about item number 1.
Item number 1 is just a part of our yearly road maintenance program. It's a friction course improvement to various locations on county roads. What we're doing is instead of paving a road where in curves where the pavement starts to polish and it gets slick, especially on days when it rains like this, we go into a micro grinding, put a texture back on, and this is allowing us to go out to bid on that project.
Okay. Any questions or comments?
No questions.
No questions. Thank you.
All right, very good. I'm going to move that we approve of item number 1, the resolution determining the necessity and concluding that no land or property will be damaged, determining that the public convenience and welfare require the 2020 friction course improvement located in various townships, Hamilton County, Ohio.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you. Thank you, Engineer Beck.
Thank you, commissioners.
Thanks.
All right, we're going to move into the consent agenda. Are there any questions related to any of these items?
Madam President, all my questions have been answered previously, so I have no questions or comments.
No questions. Thank you.
All right, in that case, I'm going to move that we approve. Oh, I do want to say one thing. The items number 2 and 3 are related to the Economic Inclusion Advisory Council. We're reappointing 4 people and then bringing 2 people new on board. I just want to thank these people for their service to the Economic Inclusion Advisory Council. We are very grateful for the service, that the time and the recommendations that have come forward from this group. It has informed a lot of the policies that we have had as we've moved through the last 3 years. So I'm very grateful to all of the above for being willing to continue to serve on this council. So with that, I'll move that we approve of consent agenda items 2 through 21.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you. Administrator Ludo, do we have anything else?
Nothing more from my perspective, Commissioner.
Very good. We all know that Administrator Ludo is going on vacation. I don't know how that works, but anyway, he is.
It doesn't. It doesn't answer your question. So I'm sure I'll be talking to you quite frequently next week.
That's right. Well, it's much deserved. I hope you have fun, but yeah, hopefully we won't have to call you too much.
Right.
Thank you.
So, Commissioner Dumas, did you have something?
Just one thing, as we receive applications in for boards and commissions, specifically, Lewis Hilton Bishop has resigned from the Tax Levy Review Committee because he is my chief of staff right now. So specifically, I'd like to see if we can go about appointing not only for that board, but also the other ones of applications that have come in. And I know we're going to be looking at levies that are coming forth. And I think the Tax Levy Review Committee would be a great one to try to fill some vacancies. So that's all I had.
Thank you. Yeah. Has that officially happened? Because I think we were actually waiting for that to officially happen.
Yes, it has.
Okay. So we have had 2 folks that had to resign for similar reasons because of conflicts of interest. And so we did have that process move. We had an application process open for 30 days. We got some applicants. And Commissioner, I will make sure that you get that listing, because I have asked my chief of staff to bring forward not only the recommendation for the TLRC, but there were a couple of other boards where we needed to either appoint or reappoint individuals. And so I think we've got 3 or 4 of them coming at our next meeting. And so we'll make sure, and I think everybody's been in the loop on that, but I'll make sure that you see all of that before that meeting where we're intending to vote on those guys.
Okay.
Okay, thank you.
Okay, I just want to remind everybody to complete your.
Oh.
Yeah, it's important.
Joe, what's the website?
I don't know.
Oh, girl. Is it Census 2020?
Yes, Census 2020.
Who knows this? Bridget Darty knows this. Bridget, what's the website?
My2020census.gov.
Voila.
My 2020 census.gov.
Bridget knows everything.
Have you filled it out yet?
Have I?
Yeah.
Oh yeah, I did it the first day.
How long did it take?
It was less than 5 minutes.
Yeah.
Yeah, it's
it took me 6 minutes. I'm a little slower reading, I think, maybe. But anyway, yeah, it doesn't take long is the point. And Commissioner Dumas, you shaking your head. I know that you did it too. So, all right. Yes, thank you for the reminder. All right, very good. If there's nothing else, I'm going to move that we adjourn.
Second.
Commissioner Dreehouse?
Yes.
Commissioner Summer Dumas?
Yes.
Commissioner Parks?
Yes.
Thank you.
Thank
Okay,
you.
thank you.